So when you think about those kind of expectations that are starting to level up for you as a second year, that's really what it's about. So first year, second year, third year, recognise, respond and manage. They are not steps up. When you come into second year, it does not mean that you are suddenly going to be at this point. What it means is that you need to be working up to that level and then beyond. Welcome back to the London Nurse. I'm Ben, and today I want to talk to specifically those people about to enter second year of a nursing course. There is often a lot of negativity around the second year of nursing studies, and there are reasons for that which I'll go into in this video, but specifically I'd like to talk about why it is so hard, that actually if you're aware of those reasons you can prepare to overcome them, and therefore second year will not be so tough for you. Before we begin, the first thing I would like to say to you is to celebrate that you got through first year. While I would agree that second year is tough, first year is you starting to explore a whole new world. Now there's another song in my head. So actually that first year can be the make or break year that everybody talks about second year being. You're entering into this almost a little bit blind. You've kind of been to, during COVID, who knows what you've kind of had, but you've been prepared to kind of go into your first year, and then you go in and it's really not what you perhaps expected. As second year, you know what it's going to be like. You might not have a clue about the placements that you're going on, but at least you've been into clinical practice, you've worked with nurses, you've worked within that multidisciplinary team, so you can kind of already identify people that can help you out when you need it. You're at a much better advantage. Sorry for any of the first years listening to this, but you're a much better advantage at second year than you were at first year. So celebrate how far you've come already and be proud of those achievements. First things first, there are always horror stories. Do not listen to anybody else. Kind of links into the second thing of kind of the second year blues. A lot of nursing students describe second year as being the hardest year of their life. And I am not trying to say that it's not the hardest year that they have experienced, but to put it into context. There are reasons again why it's the hardest, but also there are two key areas in which expectations, I guess, do increase as a second year, naturally so, as hopefully you would expect. One being the increase in academic level and therefore expectations from both yourself and academic staff. And also the second point is the clinical aspect. Now, anybody that has done or is doing a nursing program will know that it's 50% theory, 50% clinical. So all of the feelings that you might be experiencing will either fall into one of them, or the third being the kind of personal issues that go on for everybody in their day-to-day life. Now, there is a very easy way to signpost your expectations as a first year, second year and third year. I don't know where I got this from, but I got it from somewhere, obviously, because I don't think I'm this creative, but I like to look at first year expectations of being able to recognise the sick patient, for want of a better word. I'm a children's nurse, so we talk about recognising that child or young person that is deteriorating or is becoming more dependent on clinical input. So as a first year, I would, as a clinician, expect you to be able to recognise that a patient is becoming unwell. As a second year, I would expect you to then not only recognise, but to respond to that patient. So that is about starting to develop your clinical skills to respond to the patient that's in front of you, so you can manage the clinical needs of that patient more efficiently, more effectively. So that is about responding to the situation that you've recognised. So you know that that patient has started to increase their work of breathing, or their heart rate might have gone up, or their blood pressure might have gone up or down. So you've recognised that situation. Now, as a second year, we would expect you to respond to that situation. The third year is to manage that patient care. So as a third year, we are looking at you managing that patient workload and everything that kind of goes into it. And where you can't do certain aspects of care, definitely escalating and delegating to people that can. So let's go back to second year. You are expected to be able to respond to the patient that's in front of you. Now, it doesn't always mean that the patient has to be becoming unwell for you to then suddenly respond, because the patient could also be responding well to treatment or to the medications or to whatever the therapies are that they're provided to that patient. So they could actually become better, and therefore as a second year we would expect you to be able to pick up that that patient is improving and respond to that situation. So if they are on oxygen and their work of breathing has come down and the saturations are up or whatever, I don't want to get too far into that because there are many different situations in which you do not want the saturations high or patients to come off oxygen oxygen or be put into oxygen. It's just endless. That video is not going to focus on that, but focus on the patient in front of you. If they are responding well to the treatment, then let people know and start to respond to managing that patient's treatment accordingly. So when you think about those kind of expectations that are starting to level up for you as a second year, that's really what it's about. So first year, second year, third year, recognise, respond and manage. They are not steps up. So your expectation of a first year kind of working here instead of here. When you come into second year, it does not mean that you are suddenly going to be at this point. What it means is that you need to be working up to that level and then beyond. A 3-year course is never long enough to learn what you need to do in a nursing role. Otherwise, the term lifelong learning would not be around. So you do not need to know everything at the end of the 3 years. It's a bit like taking your driving test. Not that I can drive or have taken my test yet, but they kind of talk about it as being in the driver's seat with somebody next to you. You're doing everything that you need to do. They say, fantastic, you're good to drive. You get your license and then you're on your own. And it's only when you're on your own that you start to learn about the road itself and actually the responsiveness within you to the situations. So it's all about preparing yourself to level up to each year safely, effectively, but also not putting all of the stress on you that you need to kind of come off first year kind of being ready to kind of work at that level. You're in between it, so you're going to be in that kind of lower stage of level 2. So you're learning about responding to the situations around you. Now, you could have had great experiences as a first year in clinical practice where you were able to start responding to some of the patients that you were looking after. Reflect on these situations and understand what you might have found difficult about that so you can perhaps learn more about that side of it, or actually what you really enjoyed and what you did well so you can celebrate and keep doing that. So let's look at some of the kind of developing expectations that you might start experiencing where you perhaps are feeling the pinch or the pressure. Let's first look at academic stuff. So what has changed from year 1 to year 2 in the world of academia? So you perhaps could be having new methods of assessment. Do not underestimate, no matter how much you might love exams or love writing assignments or being tested in any way, that if you've never experienced a method of assessment before, it's going to be anxiety provoking, nerve-wracking. You've got to get help at this stage. So if you might be having your first OSCE, or you could even be having a presentation for the first time. If you've never done that format before, through assessments, definitely get help. Speak to your personal tutors, speak to the module leader, speak to the people that have been through those modules to get help as to what is expected of you. Do not go through it blindly. Another point is increased academic work. So you might have had, 2 assignments in your first year. You might be now looking at 3, possibly 4 or more. You have to become organised and you have to start prioritising things. Have a look at which deadlines are due first, and those are the ones that you do first. Work will start to ramp up and you might get 2 assignments at the same time. You've got to be organised and you've got to prioritise properly. There are so many YouTube videos out there about how you prioritise your workload that I ain't even going to go into it in this video. And the final thing with academia is that the marking level has increased as well. The pass mark will increase per year. So therefore you've got to look at the marking grid. It should be available to you from the university. So ask the lecturers, ask the module leads for the marking criteria for the assignment that you're doing, and it will clearly show you the benchmark at which you need to be hitting at the very least to get a pass. Without knowing that level, again, you're going through it blind. Get every help that you possibly can and you will absolutely succeed. Now let's have a look at the clinical world. So again, I have kind of 3 areas that I believe the levels are kind of stepping up. And again, the idea behind me talking about this is so if you're aware of it, you can put something into place to prepare for it, therefore it no longer becomes an issue. We talked about already the increased expectations. So you're now expected to do more than a first year, not as much as a third year. So you're in between. The best piece of advice that I can give you for what expectations you should be delivering, or achievements rather you should be delivering at second year is, or any year actually, is to go to your assessment document, go to the front of it, and the first few pages will talk you through what's expected of you. It might be written to the assessors or supervisors in practice, but they are the ones assessing you, and therefore that is guiding them on assessing you. So understand how you're being assessed. The second area is possibly around the enhanced skills or the enhanced skill set that you're expected to have as a second year. There is no way that you can learn those skills without being taught them. So go and shadow the people that are carrying out the skills day in, day out. Again, that could be healthcare assistants, could be other second year students or third year students that can help you because they've been there. They can come and work with you and develop those skills to the right level at which is expected of you as a second year. And then the kind of third bit is around just the natural step up that you're going to be feeling. You will put the pressure on yourself. You will be thinking, I'm a second year, I need to be better than I was in first year. Be mindful that your final placement of first year could have literally been 2 weeks, 4 weeks, 6 weeks before you go into your first of second year. You are not going to be any different to what you were in your previous placement. The idea is to listen to the feedback that you're being given in order to develop in those areas to become more efficient. So if you don't like it, start listening to feedback. You've got to get used to it. It's the only way you're going to learn. The best piece of advice that I can give you on how you deal with that step up is to teach people. Now, it might sound really strange, but hear me out. You will not only learn about the stuff that you don't know. So if you're teaching a student or a healthcare assistant or a parent or a child or a patient, forgive me, I'm a children's nurse, remember that. If you're teaching them about a certain skill or medication or treatment, then you will be asked questions about it that perhaps you don't know about. So by teaching something, you will unearth the parts in which you have no knowledge around, which is a good thing because then you can go away and learn and it'll be okay and better next time. But it'll also just make you feel amazing. By teaching a skill to somebody that doesn't know how to do it and you teach them that skill and they can do it, it is the best feeling in the world. And actually, by the way, that is one of the reasons why I got into education in the first place. I love seeing that light bulb moment when somebody goes, I've got it. It's just incredible. So teach people, you'll feel amazing. And just before I go, this is the all-important plea. If you are watching this and you have not subscribed yet, definitely click that subscribe button below. Leave me a comment if there is anything that you want to talk about. And until next time, I'll see you soon. Bye.